This is the day people are going to remember. This is the day when Ebola spread itself on American shores. It's the first time we've had it transfer within America. And, of course, we've already had the first person get it transferred outside of Africa. That was a Spanish nurse. This is another nurse. And we're going to have a special report from Alex Jones on this breaking story. He immediately filed a report. We're going to have that coming up after the break. But it's amazing to look at the reactions to this. And, of course, this is intimately tied with our open borders. This is what I would call open borders 2.0. This is where this is leading. We've been talking about how if they leave the borders open, it's not only going to destroy our country in terms of a Cloward and Piven economic basis, they're also looking at ways to incorporate people into this country who have not become citizens, allowing them to vote. We've even got the Mexican consulate paying to shield illegal immigrants in the U.S. from deportation. That's another story that was up on Infowars.com that was put up yesterday. Actually, we're going to talk about that as well. But let's get back to this Ebola patient. This was transferred today. We learned about it. It was actually, she fell sick on Friday, went into the hospital, and as they reported, she was following procedures as she had been given it, following protocols, and they say, well, obviously the protocols were violated. Yeah, the protocols have been violated in a number of areas for quite some time. We were called fearmongers here when Alex Jones and Infowars was talking about not bringing back patients from Africa into the United States and putting them in less than level 4 biohazard containments. We've talked to scientists who do research with Ebola. They were surprised at the breaking of protocols. Other health workers were surprised at that. Even the cleaning guys who cleaned up the vomit on the sidewalk 4 days after it happened, they wore protective suits. I'm sorry, not the cleanup guys who cleaned up the sidewalk. They did not. They came out with just shirt sleeves and with a high-pressure sprayer. But the guys that got to come in, I believe it was the next day on Friday, it was a company, I think, called the Cleaning Guys. They said they took the recommendations up a level from what the CDC was recommending. In other words, when you're dealing with something this potentially deadly, that has such a high percentage of people who fall ill to it die, when you're dealing with something that's that contagious and we don't have it under control in Africa, wouldn't you want to go an extra level and take an extra level of precaution? Clearly, they are not under control with this, both in Spain as well as here. The Telegraph reports that she was taken in, and this is the optimism, okay? Is the glass half empty or is the glass half full? Well, the Dallas officials put a smiley face on it, says she was taken into isolation within 90 minutes of arriving at the hospital. What was she doing before she was taken into isolation for 90 minutes in the hospital? We saw this happen to the nurse in Spain as well. She tried on 3 separate occasions over a period of 1 week to get medical care when her temperature went up. She was somebody they knew was working with the Ebola patient. Yet on 3 occasions, they paid no attention to her. Finally, when they realized that she had the disease and they kept her there, they left her in the emergency room for 8 hours, exposed to people who were coming in as well as to medical staff. When they took her in for treatment, she was so violently ill, she was vomiting and had diarrhea. Bodily fluids were everywhere. Of course, you can get it from just touching someone without getting into that level of exposure. But the doctor who worked on her complained about the fact that his suit didn't have sleeves long enough to cover his arms. That's what we're seeing here. We're seeing a kind of an arrogance from Western governments that this can't happen here. And they're trying to do this partially to contain people, to not allow panic to break out. But it's also gone far beyond that, as we pointed out, to a level of deliberate hubris to casually stand down and not follow these procedures. They're not just telling people not to worry and then behind the scenes doing everything they can and above and beyond. No, they're not even doing that. And so we're seeing this now, the first case transferred to the United States. Stay with us right after the break.
It's Sunday, October 12th, 2014, as we issue this emergency alert report. It has now been confirmed in Dallas, Texas, the site of patient Zero's death last week. A nurse who was treating him at the Presbyterian Medical Center in Dallas, Texas, has tested positive for contracting Ebola, the deadly virus ravaging hundreds of thousands of people right now, potentially could infect millions in Africa. And now it has spread in the United States, just as it spread last week to another nurse, a healthcare worker in Madrid, Spain. So there are several big questions, obviously, here, and several big issues. Why, for the first time ever, are they bringing Ebola patients into Western countries like Spain and the United States? Why, when other nations like England, France, and Arab countries as well have blocked flights out of countries being ravaged by Ebola, why has the United States not halted flights and is still not even doing basic screening at major airports? Another big question, why did Obama lie to us and say virtually no chance it would come here? Why did the CDC say, hey, we can't control the border and we don't think it's going to spread? Why did the head of the Texas Medical Board come out last week and say that there was basically zero chance Ebola could spread, when we know it's been spreading like wildfire in Africa? And many scientists, many virologists, even in the New York Times, have come out and said it may have already begun to go somewhat airborne. So to be clear, there is now an official outbreak of Ebola in the United States. And if this healthcare worker was in a full hazmat suit, you better believe that the children, the wife, the neighbors, the children at the school where these other children went are all obviously in danger. And I think it's safe to say what we said a week and a half ago when this news first broke. The odds are this has spread to wider groups of people. And patient zero, who's now dead, Thomas Eric Duncan, who died last Wednesday, is not the only one. And now that speculation has been confirmed
by the news that a healthcare worker in Texas has tested preliminarily positive for infection with Ebola virus.
CNN headline, Texas nurse tests positive for Ebola, would be first Ebola transmission in the United States. Dallas Morning News, healthcare worker at Presbyterian Hospital in Dallas tests positive for Ebola. CDC protocol breached in treating Ebola patient, Associated Press. And that's the big point that has to be made here out of all these important issues. The default position of not bringing Ebola patients into the United States, that was violated for the first time when I pointed this out, when other people pointed this out, when the Drudge Report pointed this out. Mainstream media demonized us and criticized us and said, how dare you not want to bring Ebola patients here? You must be racist. How dare you fearmonger and say people could be coming across the border with it? Well, now a nurse who is in full hazmat gear has contracted it at the hospital where this person was for a week. And remember, they didn't clean the ambulance for days. They sent some of the kids to school for days, even after they knew patient zero, who's now dead, had Ebola. Evidence is also mounting that the CDC is lying to the American people. Foreign press reported that Mr. Duncan had died a day before and that the CDC was basically covering it up, and that forced them the next day to claim that he died Wednesday morning. There's major evidence that we're being lied to. Ebola patients are being brought in. They're not following proper protocols, and it's spreading. And when we point out that the southern border should be highly controlled as well as the northern border, and that everyone who was on this flight with him should be put in containment, we're called conspiracy theorists for following the default federal law. So clearly, elements of our government want this crisis to get out of control. The good news is the head of Southcom, the U.S. military branch that oversees Central and South American U.S. interest, came out last week and said the big threat is Ebola coming across the southern border.
Many countries in the Western Hemisphere have about no ability to deal with an Ebola outbreak. We have a lot of West Africans, of the Homeland Security folks doing their work on our southwest border. Of the number of people they capture, a very large percentage of them are West African. I was down in Costa Rica a couple of weeks ago talking to our embassy personnel. One of them relayed a story to me. But there were 5 or 6 black guys that were there at the border waiting in line to pass into Nicaragua and then on the way north. and the embassy person walked over and just asked who they were, and they said, well, we're from Liberia, been on the road about a week, and we're on the way to New York City, illegally. So they're on the network. They had flown into, I think, Trinidad, and then met up with the traffickers, and now they're on the way in. They could have made it to New York City and still be within the incubation period of Ebola. That if there's an outbreak in the Caribbean, particularly, or in Central America, it will make the 68,000 unaccompanied children, I think, look like a small problem.
The UN estimates run from 1.4 million to 5 million people in Africa alone by December who will contract Ebola. Undoubtedly, many of them will try to flee to the West. Other countries, including African nations, are not letting them in because that's default common sense. So now the U.S. is the dumping ground of people who have contracted Ebola, and now it's confirmed to be spreading in the United States. We, the people, have to take action. Call Congress, call the media, call the White House, call the CDC, and say, listen, you follow federal law, you follow the defaults, and you quarantine the people that have been in contact. You shut that border, you stop those flights, or you will be held accountable when this spreads and they're quarantining hundreds of thousands or millions of U.S. citizens and North Americans. This appears to be a false flag that they've bare minimum allowed to spiral out of control as a pretext for more medical tyranny here in the United States and worldwide. Finally, I want to leave you with a clip that our reporters got last week with the head of the Texas Health and Human Services Commission, Executive Commissioner Kyle Janik, saying to the legislature that there's zero danger, even if Ebola was on the table right in front of him. It's clear they're trying to pacify the public and cover up what's happening, not to stop panic, but to stop a real response.
There is virtually no risk. You can push me as far as you want to say zero. I will not say zero. It's knowing what I know. There is zero risk. I said it. There it is. I shouldn't say that. There's no risk. There's no risk. Ebola virus could be sitting there, and if I'm touching it with unbroken skin, it's not a risk.
Well, folks, we've put the facts out here. We've been proven right again. Now it's up to you to take action and raise the alarm. We'll take you back now to the radio studio where David Knight is live, breaking this down and taking your phone calls right here in Austin, Texas, and worldwide.
That's right. We're going to be going up to a break in a moment. If you want to call in and talk, especially if you're a healthcare provider, that number is 877-789-2539. It's a different number on Sundays. That's 877-789-ALEX. So if you want to call in, especially if you're a healthcare worker, first responder, we'd like to know what you think, because this is what they're saying. They're saying the Dallas health worker who looked after the first Ebola victim, this is the Telegraph, was wearing a full protective gown, gloves, and face shield as she cared for him. Now, we've been told by Obama that there was absolutely no risk of this coming to America. We were told by the Texas official, as you just heard in that report, there's no risk of it coming. We've been told by the Dallas judge who's working with Homeland Security, there's absolutely no risk. Really? I don't think so.
In the past decade, we have witnessed unparalleled scientific discoveries in the area of health. But no one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. DNA Force is one of the most expensive formulas to produce. Some of the ingredients in DNA Force are $12,000 a kilogram. We are using the coveted, patented, only American source of PQQ, CoQ10, and more. You want the best that's out there at the lowest price anywhere? Well, we're bringing you a total win-win. The ultimate value, cutting-edge, trailblazing game changer that also supports the InfoWar. We have produced a limited run of DNA Force, and it will take up to 12 weeks to produce more once we sell out. Secure your DNA Force today at InfoWarsLife.com or call toll-free 888-253-3139. DNA Force from InfoWars Life.
If you're you're just joining us, we had a special report from Alex Jones about the new developments in Ebola. Of course, we've had the first patient in America to contract it in America, and the second one to contract it outside of Africa. Of course, the other one being a nurse in Spain. And this was a nurse in Dallas who contracted it. They're telling us that she was wearing full protective clothing, just as the CDC told her to, but now they're looking at 48 healthcare workers. They say they were considered to be at low risk of developing the disease, but now they're taking a closer look at them. Well, I would hope so. Dr. David Varga, the chief clinical officer, said this individual was following the full CDC guidelines, and we're very concerned. I'm also very concerned, as this report says, that the victim was taken into isolation within 90 minutes of arriving at the hospital. 90 minutes, she was taken into isolation. What was she doing for the first 90 minutes? She was not in isolation. We saw this happen, of course, in Spain as well, where the nurse there had to try 3 times to get help over a period of 1 week. When she finally went back the last time, she was in the emergency room for over 8 hours after they realized that she had Ebola. When she was finally taken in for care, the doctor who was working with her as she was violently vomiting had diarrhea. That doctor did not have a suit that covered his arms completely. This is a very, very dangerous situation. We don't fully understand, I believe, how it's being transmitted. We've said this from the very beginning. If they cannot control this, if it's doubling every 2 weeks in Africa, then I think we need to go to another level of containment. Perhaps there's something about this that they don't understand. They're saying that they know that it's not airborne, but we've seen some studies that might indicate that was the case with animals. And of course, to say that it's not airborne doesn't mean that it can't be transmitted via aerosol. To say that someone cannot transmit it before they're exhibiting symptoms, I don't believe is necessarily true either. They're telling people that you're still shedding the virus in bodily fluids as well as sexual fluids for several weeks, up to months after you have convalesced from this. They've seen this. But then they say, well, we haven't proven that anybody could get it from that. Well, they're still telling people to keep apart from others sexually and in other ways, still be concerned about those fluids, and yet they're not concerned that it could be transmitted that way prior to somebody exhibiting a fever. So there's a lot of questions about this. And of course, as I mentioned in the very first segment, we had the guys who went in and cleaned up the apartment 5 days later. That's how long they took to do a response. But the cleaning company that went in took it to another level from what the CDC had told them. They went to the next higher level. They wore respirators because they're not convinced that they can't get it from airborne aerosols. And of course, Stefan Molyneux had a great video that he's put out about this. He says, of course, it's already gone airborne. We've allowed it onto airplanes. That's one of the most dangerous ways to make it go airborne. That's something that is far worse than coughing or sneezing and transmitting it to someone that's just across the room. You can take it across continents that way, and now we're seeing that happening. Of course, the CDC says the protocol was breached in treating this Ebola patient. They don't know exactly how. The doctor there says that they followed all procedures, that they wore protective clothing, but he's saying somehow our protocol was breached. Well, you know, the protocol for containing dangerous diseases like this was breached many times by the CDC. That's what we've been saying for the last couple of months. The fact that they brought patients into the United States, the fact that they allowed travelers to bring it in, that they're not containing it within that country. Those are breaches of protocol that you would use in a dangerous pandemic like we have going. And this is far greater than anything we've ever seen in any previous Ebola outbreaks. There's been several Ebola outbreaks. It's affected anywhere from dozens of people. The worst 2 prior to this were 300 and 425. This is way beyond that. It's doubling every 2 weeks still, and they say that if it continues this curve, we're going to see anywhere from 500,000 to 1.5 million people in the 2 primary African countries of Liberia and Sierra Leone by December. By December. That's 5 to 15% of the combined population of those 2 countries. Work those numbers out to the United States. Think about if 5 to 15% of the United States were to get it. But of course, we're doing something about it. We're sending our soldiers into that area, even though nurses with protective clothing are contracting it when they care for patients in Spain and in the United States. We're going to send thousands of military personnel into that area. Absolute insanity. completely standing down. And look at what's happening at the border. We just had this report. We played it on Friday. Dr. Eileen Marty is someone who was treating patients in Sierra Leone. She came back into the country, and she was absolutely amazed. Here's what she said.
How many days did you spend in Nigeria?
31 days.
Okay, 31 days. Then you come back to the U.S. through Germany. Which city in Germany?
Frankfurt.
Frankfurt. You go Frankfurt, Miami, nonstop.
Correct. Yes.
And then you land in Miami.
I get to the kiosk because I'm a global entry person, and enter the information, put my fingerprints, and mark the fact that I've been in Nigeria, and nobody cares. And
nobody stopped you.
Nobody.
Not a single test.
Nothing.
That's what we've heard over and over again from healthcare people like this doctor who is setting up protocols to try to keep it out of Nigeria, to try to keep it from leaving Nigeria. We heard the same thing when the news crew came back. They said they had been covering it directly, and they said, oh, yeah, I think I heard something about that. They go away for a while, and then they come back and they say, you should watch out for signs of developing Ebola. And she said, well, what should I look for? I don't know. And they let the two people traveling with her, who are cameraman and producer, they also let them through. Same thing we heard from Dr. Gil Mobley in Atlanta. He staged a protest in the airport wearing a protective clothing suit to try to draw people's attention to the fact that nothing is being done to screen anyone. Now, when they touched down the Marines at the hot zone in Ebola, they had Liberians come out and take their temperature. We don't do that. It's exactly the opposite. I mean, if it wasn't being engineered, if they weren't doing everything they could to spread it, we would be living in a complete idiocracy. But I don't think they're that stupid. We're going to be talking to you, taking your calls coming up in the next segment. We're also going to take a look at the money trail with Big Pharma and Ebola. Stay with us. We'll be right back.